Hi everyone, Colleen here from Let's Talk About It. Today I want to give an update as I'm several months from my, this is what happens, occipital decompression surgery. And I also got the results of cognitive testing. So let's talk about the surgery. So far, so good. My nerves in the back of my head are pretty much all numb. They should start waking up in June or July. So I'll see my doctor again in July. I think the scar is looking pretty good. My hair is growing back. So yeah, so far so good. It's pretty numb around my scar area, so it's not really bothering me. I can sleep better, put my head down and those kind of things. I did go to the dentist recently and I did have some trouble there, so she had to move some stuff around. But, don't be afraid to talk to your doctors or whoever and say, hey, I need a little help with my head here. So I am getting a consistent pain here. Actually, I've been writing down in a journal every day, like what I'm doing and pain and all that. I'm not sure what that's about. I don't know if it's from the surgery or something else, but it's a piercing pain that's in the same area all the time. Interestingly, it gets worse when I do cognitive work. So I don't know. We'll see what happens with that. I'm going to see my brain injury doctor soon as well, because I just finished doing cognitive testing and getting the results. So cognitive testing is a thing. I wanted to get that done because I would like to go back to work, but I'm very aware that my processing is slow. My working memory is not good. I do get aphasia. I have some issues with talking sometimes, especially if it's, if I'm talking quickly, if I do have a headache, if I feel rushed, and also if it's like if I'm trying to pull back law kind of stuff from my old job, if I'm trying to reach back and get that information, sometimes I stumble. So I don't know what to do about that. So anyway, I had the cognitive testing and I met with the doctor the other day. I'm waiting for the full report, but essentially I had cognitive testing a couple months after my injury, which was December 3rd, 2023. I guess about 5 or 6 months after that. And I had impairments. Some places I did okay, but I did have impairments. And this time it was much worse. So it's interesting. It's 2 years later and I'm doing worse cognitively. So I have been diagnosed with occipital neuralgia, vestibular migraines, and also post-concussion syndrome. So after talking to the doctor, it seems clear to me that what they call it is actually persistent post-concussion syndrome. So what that is someone who has the symptoms of a concussion for, longer than, a few weeks or a couple months. So here I am 2 years later. So what are those things? I couldn't figure out why I was so fatigued, and I talked to you guys about that. So fatigue is one of them. Insomnia, I get real bad insomnia 2 or 3 times a week. I do get the headaches. Again, part of that is occipital neuralgia, part of that is vestibular migraines, part of it is the concussion. So, but I do get headaches daily. I do get dizziness daily. Sometimes it's worse than others. Obviously, when I have more of a headache and more triggers around me, especially noise, my balance gets a little more screwed up. So again, that's part of vestibular migraines, but that's also part of post-concussion or persistent post-concussion. So it's going to be interesting to, tease those apart and see what's what. Light sensitivity, sound sensitivity. It's interesting because all those things are also persistent post-concussion syndrome. So, I'm calling I'm going to meet with my brain injury doctor soon and also look at the recommendations. But basically, I'm supposed to start vestibular therapy in May. And, that's, you might have a string with, different beads. So you're focusing here and then here and then here. And then you do the things where, you have to move your eyes, back and forth and then like this. You have to walk in a straight line while moving your head, but keeping your eyes on a single object. I'm closing my eyes so I don't get sick. we'll see how that goes. I am having trouble walking still, and I was just away with my sister, and I thought, I was holding on to her like almost every day while I was going places. And I thought, if it continues, I would very seriously think about getting a large dog and training it to be a balanced dog, because that happens. I don't fall. It's usually like a whoa, whoa, I don't necessarily fall, but it's not good. And there's a lot of things I can't do, right? I can't go to concerts. I can't go to restaurants that have live music. They had a maze of mirrors. No way. I tried to do a professional baseball game. No good. So there's a lot of things I can't do, but there are some things I can do. So I look forward to talking to her and finding out what to do. The other thing the doctor said, besides the persistent post-concussion syndrome, is called centralized sensitization, which basically, and I've heard this for a few years, so I'm curious if any of you have this and how you deal with it. The concept is that, let's say with pain, some people, their pain level's here, and then, to top out your pain level that you can't handle it, you have a pretty good gap. But for me and people like me with post-concussion syndrome and other things, it's like your brain's been conditioned. It's almost like you're up here already. So your nervous system is like hyper vigilant. So when it feels pain big. When it hears sounds big. When it's perceiving light, it perceives light bigger. So there seems to be a lot of different kinds of therapies for that. I don't know how that works. I think it's like reconditioning your brain. I hope that works. Again, we're going to have to tease apart what part of that is vestibular migraine, what part of it is the persistent concussion thing. But I thought that was interesting, centralized sensitization. So I liken it, to someone who has anxiety, generalized anxiety, say, and their brain, it is good that our brain sends signals of danger for us so we can avoid something or, fight, flight, whatever. But it puts you in fight or flight, right? And as someone who's going through counseling or whatever with anxiety, they learn to kind of question, hey, is that danger sign in my brain really, is that dog over there across the street really something I need to freak out about? You're right. So it's kind of reconditioning your brain. And I get the sense from some of the research I've done that it's very similar to this, where my nervous system has already been conditioned. And I've had a lot of medical injuries and issues over the last, 10 years, one after the other. So it makes sense to me that my nervous system is almost always in a fight or flight. I don't feel that way necessarily. I meditate a couple times a day. I definitely practice mindfulness, grounding, those kinds of things. But biofeedback might be something we're going to look at. Medication might be something we're going to look at. We might be looking at speech therapy, occupational therapy. I'm not real sure. It's very new to me. So, I'll take you for the ride on that. I don't really know. So there's three things we're kind of dealing with. We're going to deal with the recovery from my occipital nerve decompression surgery, which went really well. But we don't know how well it went until my nerves start to wake up and we see what my level of relief is, which is great because that's pain. The vestibular migraines, again, I have crazy sensitivity with sound. We know that I have trouble on elevators, and I get, migraines pretty much every day, and that hasn't changed. Now, the other piece is I have these cognitive issues, which are significant. I did a lot of higher level thinking. I worked a lot in my job. I would, do meetings for hours and hours. I loved my job, heavy reading, heavy research, heavy analysis, and I loved it. But I have a really hard time now, especially verbal information. My short-term memory is not good. I have a really hard time remembering things. And one of the biggest things is my working memory. I have great difficulty adding very simple numbers in my head, or let's think of a sentence and how I want to maybe change some of the words or the grammar. I can't do that in my head anymore. Once new information, let's say I'm playing poker, right? I used to love to play poker. Once someone speaks to me, I forget my cards. Once I count the pot, I forget my cards. I don't remember how anybody bets. Like, I can't hold on to that information anymore. So I don't know. I don't know how we fix it. I'm nervous, to be honest. Like, I'd like to go back to work. I just don't know if I can. And then, of course, all of those cognitive things become way more difficult when there's distractions around me, whether that's fluorescent lights, terrible, obviously sounds or movement and things like that. So, we'll see. I do have trouble driving at night still, I think because of the lights and things like that. But I don't know. We'll see how it goes. So that's where I am. That's the update right now. So I think maybe in a month, maybe in May, if I can start the vestibular therapy, I will hopefully video some of that and show it to you. And then we'll see how I do. One day at a time, really. I think that's it. So thank you to my doctors for sure. And I look forward to seeing my brain injury doctor and asking her what the next steps are. All right. Take care, everybody. Have a good one.